Hello, I'm back again. I know it's been a minute since you heard my original voice, if you've been keeping up with all the videos. Just thought I'd try to do something different, break up the monotony, if you want to call it that. Today, I want to go over a research finding that says Tai Chi, jogging, and yoga pretty much have the same effect as pills when it comes to treating insomnia. So according to a research entity called BMJ Group, it says yoga, Tai Chi, walking, and jogging is pretty much some of the best natural remedies from improving sleep and tracking insomnia. This is based on a large analysis comparing various treatments and also combining that with cognitive behavioral therapy. They wanted to compare it to cognitive behavioral therapy, which is pretty effective. But I think the issue with that was they didn't have enough therapists to provide that treatment to the number of people that need help for insomnia. But the findings show that exercise-based approaches, especially like Tai Chi, jogging, it's supposed to improve. They say it usually improves the total sleep time, efficiency, and reducing how long people stay awake after they fall asleep. So the findings basically back the use of exercise as a primary treatment strategy for poor sleep as opposed to pills. Now, I know some people do complain because I used to sometimes, I used to work out at night, and some people used to ask me, how can you do that and fall asleep? Because they used to say that it was hard for them to fall asleep because they were kind of amped. But yeah, this study doesn't show, or it doesn't say when they exercise, it just says exercise. So maybe it is earlier in the day. Maybe I should exercise earlier, I don't know. I fluctuate myself. But basically, the insomnia is pretty much defined or described as difficulties falling asleep or staying asleep and waking up too early. It says it ranges from 4 to 22% prevalency. And this is associated with a heightened risk of various mental and physical health conditions, including dementia and cardiovascular disease. Yeah, that's concerning, especially when you get older. I think it's also just something in our culture that is increasing dementia, because you don't find it prevalent in other places as far as when you compare it to these Western English-speaking cultures, right? A lot of other cultures don't have an issue with dementia or people losing their cognitive abilities as they get older. These findings also state that the drug treatments for insomnia are not without side effects, which makes sense. I think that's why they say cognitive behavioral therapy is preferred. But again, the issue with that is there's not always available therapists and a shortage of trained therapists to explain the research. And although the findings say that exercise is beneficial, it doesn't exactly specify which types of exercise might be most beneficial. It just kind of ranges, it's kind of vague. It just says jogging, Tai Chi, yoga. I'm not so much into Tai Chi and yoga. Maybe it's the meditation, but I'm big on the physical part. I guess it regulates your heart rate as well. And then it probably helps you sleep because your body needs to rest. So it's easier for your body to kind of, for lack of a better term, feed on the rest. That's just my perspective on it. So this BMJ group, they scoured a research database and they were looking for relevant randomized clinical trials. I think published up to April 2025. It included 22 trials in a network meta-analysis. It's basically a statistical technique used to compare multiple interventions at the same time. So the trials involve around 1,350 participants with 13 different treatment approaches to ease insomnia. Seven of it was exercise based. That included yoga, Tai Chi, walking, jogging, aerobic, plus strength exercise. This is the first time it mentions strength training, or even strength training alone. It says aerobic exercise combined with therapy and mixed aerobic exercise. Yeah, again, if you're doing all this, your body's going to crave rest, so I can see how it would help you sleep. Actually, they said these programs lasted for about 4 to 26 weeks. The other approaches included the cognitive behavioral therapy again, sleep hygiene, acupuncture, massage, doing nothing, and existing treatment like the usual care or lifestyle changes. They even had scoring systems, as well as these subjective and objective measures for total sleep time. This sounds pretty, I guess, like hairy in a way. I guess it should be. They also went for the number of times people woke up in the middle of the night. They also looked at sleep quality and their sleep patterns. They said compared to the cognitive behavioral training, it's likely to result in a large increase in total sleep time based on a subjective sleep diary data. It says also may improve sleep efficiency and shorten the amount of time you spend awake after falling asleep, as well as sleep latency and sustained improvements. And what else does it say? I read this article, I keep saying article. I read this research finding 3 times. It's hard to remember all this. Basically, it just comes down to exercise-based interventions. It seems to be more effective than pills. I mean, I guess, and I don't want to sound, I'm not a doctor, but yeah, this seems a lot better than taking something with side effects. And we don't know what's in the pills. We don't know what kind of odious elements are in there. But I think there's always better alternatives to everything, to any type of healing. Even when it comes to like physical injuries, I think rehabilitation is always best. Sometimes people like to just cut too much. Just, cut this and pull that and stick this in. I mean, sometimes people need to be patient. Things take time. I've been impatient with injuries. I've been impatient with ailments I've been dealing with, and things take time. I guess with this too, it seemed like it worked fast though, as far as like exercising and trying to improve your sleep. Because again, this is to me, and I could be wrong, it would just seem like your body would crave the rest. But there are some people who just go, and some people are just night owls. And some people have different work schedules that throw their body off, which makes sense. But I think this is a pretty interesting study, and I think we should all find ways to improve our sleep quality. I'm not gonna ramble on too much. Just thought I'd give you a chance to hear my voice again, and I appreciate you listening this far. And please like and subscribe. Again, thank you for listening.